Hello, Dr. James Bogash, expert in health and longevity. And this is one of those studies that just bugs the heck out of me because it's the rationale is very obvious, and B, it just shows how off kilter we are with medicine these days. And this particular study has to do with eosinophilic esophagitis, which is a pretty common cause of problem swallowing, heartburn, chest pain, all of those things that can fall into that. A lot of cases of reflux or GERD have to do with inflammation in the esophagus, but eosinophilic esophagitis has to do with the white blood cells that are related to allergy. So food allergies play a huge role in eosinophilic esophagitis. But where does that start? And the earlier we know that infants who are given antibiotics, it completely throws off their microbiome, and largely most doctors are not even aware of this fact, let alone how to rebuild an infant's microbiome. You couple that with, it seems like it's backed off lately, but the first time I had an infant come in that the parents said that the infant was put on Prilosec, I about lost my marbles, because that seems absolutely ridiculous to block acid, which is important for gut development and everything. And sure enough, there was one study that looked at how appropriate it was. 82% of the prescriptions for Prilosec in infants were inappropriate. Like, that's crazy bad medicine. So I've written about this in the past, about how to address those digestive issues. But the challenge here is that both acid blocking drugs in infants and use of antibiotics throw off the immune system many times for a lifetime. So this study looked at the use of antibiotics both in pregnancy and as an infant, and how it had an effect on the later development, like 5, 6, 7 years later, of eosinophilic esophagitis. And the links were incredibly strong, but again, not a big surprise. So in pregnancy, if mom got antibiotics, it increased the risk of eosinophilic esophagitis, or EE, by 50%. If she had 3 or more courses of antibiotics, which in a 9-month term just blows my mind, 210% increase. So, not good. And then as an infant, if they were given antibiotics, had a 40% increased risk. If they had 3 or more, it was an 80% increased risk. This is pretty substantial. But what if they were given acid blocking drugs? Goes through the chart. 1,590% higher risk of eosinophilic esophagitis. When we boil back down to the fact that most of these prescriptions are written inappropriately, and there are downstream ramifications of that, it just blows my mind that this is how we practice in pediatrics these days. But even more problematic was that last year in May, Dupixent was approved for eosinophilic esophagitis, and everybody was clapping their hands and patting each other in the back, saying this is the first time we have a treatment for eosinophilic esophagitis. Well, no. What's happened is you've developed food allergies, so the treatment is to stop eating the freaking foods that are irritating your esophagus. And that's not about doing food allergy testing, which I'm not a big fan of. It's more about doing elimination diets and seeing what happens. There's an eosinophilic esophagitis study that I refer to quite often, and in this study, people were like, hey, do you have any food allergies? And they tested, and everybody's like, no, I don't have any. 92% of the people in the study had food allergies. When they went off the food allergies, their eosinophilic esophagitis went away. We have treatment, we just don't have drugs, and the drugs in no way fix the problem. Once your immune system is thrown off kilter by antibiotics or by acid blocking drugs, we need to identify those food allergies to calm the immune system down. So this whole scenario just gives me the willies in how we treat infants, how we set up the development for eosinophilic esophagitis, and then later how we treat it or really don't treat it. We just try to mess with the immune system. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.